Heart valve repair or replacement, surgery. The heart valves open and close to keep blood moving in the right direction through the heart. Disease or defects in the heart valves can disrupt this normal blood flow. This can cause symptoms such as tiredness, heart palpitations, and trouble breathing. These symptoms come on gradually. In some cases, a damaged heart valve needs to be repaired or replaced. Sometimes this heart valve work is done with open heart surgery. Reasons for the procedure. The most common reason people have heart valve surgery is because of a leaking or narrowed heart valve. These conditions can make the heart work harder to get blood into the heart or out to the body. When a heart valve is leaky, it is called regurgitation. The heart valve doesn't close completely, and some blood flows backward through the valve. When a heart valve is too narrow, it is called stenosis. The valve opening can become narrow and stiff, limiting the flow of blood into or out of the heart chambers. Your surgeon may try to repair your damaged heart valve. If repairs are not possible, the valve will need to be replaced. Before the surgery. Before heart valve repair or replacement, you will have tests to fully look at your condition. These tests may include transesophageal echocardiography. For this test, a thin, flexible tube will be guided down your throat and into your esophagus. This is an imaging test that uses sound waves to make moving pictures of your heart and heart valves. You may also need blood, urine, or other lab tests. Your healthcare provider will also want to know about all of the medicines you take. This includes prescription and over-the-counter medicines. Do not eat or drink anything after midnight the night before the surgery. During the surgery. Just before the surgery, you will get anesthesia so you won't feel any pain. You will sleep through the surgery. The surgeon will make a cut down the center of your chest to reach your heart. The surgeon will separate your breastbone. Your blood will flow through a heart-lung machine during the surgery, so your heart and lungs will be still. In some cases, regurgitation can be fixed by repairing the cords that connect the valve to the heart. This lets the valve close tightly and helps limit regurgitation. Or the surgeon will remove part of the valve to help it close tightly. The surgeon may also tighten or reshape the ring of tissue that supports the valve. He or she may add a ring structure for support. Stenosis can be repaired by separating the valve flaps. This opens up the valve, or the surgeon may remove deposits of calcium and scar tissue from the valve. This will make the valve more flexible and allow it to close as it should. If the damaged valve can't be repaired, your surgeon will replace it with a mechanical valve made of strong, durable material, or a valve made of human or animal tissue. Once the surgeon finishes the procedure, he or she will rejoin your breastbone. After the procedure, you will stay in the hospital after the surgery. For the first few days, you may be in intensive care. Once your healthcare providers feel that you are well enough to go home, follow all of your instructions for medicines, pain control, diet, activity, and wound care. Make sure to keep all your follow-up appointments. It can take 6 to 8 weeks for your breastbone to heal. You will need to limit how much you move, lift, drive, or do other activities during this time. Depending on the type of valve replacement, you will need to take medicine to prevent blood clots for the rest of your life. This keeps a blood clot from forming in the valve. A blood clot can break free and cause a stroke or other problems. Your surgeon will talk with you about this medicine before and after surgery. Before you have any dental procedures, always tell your dentist that you have had valve repair or valve replacement surgery. Your healthcare provider may give you antibiotics to take before your dental work to prevent infection of an artificial valve. Things to remember. Open heart valve repair or replacement is done through a long cut in your chest. If your heart valve is replaced, you will need to take a blood thinner for the rest of your life. What we have learned. Healing after open heart surgery can take 6 to 8 weeks because the breastbone needs to heal. True or false? The answer is true. You will need to limit activities such as lifting and driving after surgery. Having a heart valve replacement requires that you take a blood thinner for the rest of your life. True or false? The answer is true. This medicine lowers the risk of a blood clot forming in the valve.